Today's topic is, am I a good candidate for self-funding? If you want an answer to that question, you really need to find a self-funded expert. They're going to evaluate self-funding on a number of different factors. Here are some of the things an expert would consider. Number one, the number of employees enrolled in the health plan. Size does matter. For example, in certain states, they're going to have different requirements on how many employees you must have before you can actually self-fund. In the state of Illinois, it's 10. In addition to that, stop-loss carriers may only underwrite down to a certain number of employees. Very common for 50 or 100, but there are plenty that go below that. Number two is data. In the absence of data, an insurance carrier is simply going to add margin or decline to quote. Access to data is key in determining if self-funding is viable for you. Don't worry if you think you can't get access to your data, because there are creative ways to get it that you probably haven't heard of. The third is cash flow. An employer must have some level of tolerance for month-to-month cash flow variations if they are considering being self-funded. That tolerance is employer-specific, but can be significantly mitigated if set up the right way from the start. The fourth is tolerance for change. Tolerance for change is directly tied to how much you can control your risk as an employer. The higher tolerance for change, the more you can control your risk. Don't be fooled though, change does not always mean something negative. There are plenty of things you can do in a self-funded environment that are a positive change for members. My advice to you is, if you're considering self-funding, find yourself an expert. And if the only answer you're getting right now is you are too small to self-fund, you probably do not have an expert.